What's up, everybody? This is Josiah. Wanted to talk about something that over a third of U.S. adults suffer with. It's called fatty liver disease, non-alcoholic form, not related to alcohol. Some of the studies say that 50% of adults will have fatty liver disease in this country. So the question is, how does it develop? So here's your liver. Here's some fat circulating in the artery shown here. Insulin resistance. The cell no longer accepts insulin. The prediabetes, diabetes develops, and in circulation, we have too much of this. These fatty chains, they're called free fatty acids. They're circulating, and the only place they get to go is back to the liver. The cells don't want the insulin, rejecting the fatty acids. Some of the fat cells start dumping it into the bloodstream, and the only place they can go is in the liver. And the problem with fat in the liver is it chokes the hepatocytes, the cells that make our liver help us detox things and control our metabolism. To the right here, we have an actual biopsy under microscopy, a picture of liver cells, and these white circles are, you guessed it, fat droplets. These are not supposed to be here at this quantity. This is literally choking to death all the functioning liver cells by fat. All right, so let's get into it. So the thing is with fatty liver disease, most people don't even know they have it. They're running around collecting fat in their liver because they're pre-diabetic, or they're in the early stages of insulin resistance that eventually will become prediabetes and diabetes. There is no symptoms usually with this. You can have an increased liver mass, so under exam, somebody knows what they're doing, can feel the liver is increased in size, but that usually is a late stages when that liver is filled with tons of fat. Now, what happens is a blood test called AST, ALT that your doctor will check on a comprehensive metabolic panel will have very mild elevation, 2 to 5 times normal. I've seen it mostly 2 to 3 times normal unless it's real severe. AST and ALT are dumped into the bloodstream from the liver if the cells are being choked or injured. And so we get a mild elevation of this in the moderate stages of fatty liver disease. So this can be diagnosed by ultrasound once we have a reason to use the ultrasound because we found some elevations in liver enzymes. And they call it an genicity liver, a bright liver. And if you go to the picture here, so what happens on ultrasound is we're going to actually image the liver with that right kidney. And you'll notice the coloring here is very similar from the liver to the kidney. Now, if you go to the right here, look at what the kidney or the liver looks like here and how dark this kidney is in comparison. So back to the left, these are very similar. These are not. The kidney is much darker than this bright echogenicity liver here. Hyperechoic is another name. It's reflecting those sound waves off the ultrasound. So this is how it's diagnosed, excluding other things like testing for Hep B, C, and A, medications that can be causing liver injury, causing the liver to have some injury, inflammation, collecting fatty acids. There is no autoimmune disease on board, which would usually occur in a younger patient. We're typically not looking for that in a 65, 70-year-old man or woman, but somebody that's 40 years old, we may run anti-liver kidney panel, anti-mitochondrial antibody panel, checking the liver, including lupus panel, just to make sure nothing else is driving this fat to store in the liver. The other thing we usually do is run a ferritin panel, and ferritin is a storage iron protein, but it's also an acute inflammation reactive protein. So under acute infections or inflammation, ferritin will start to pull iron out of the blood, and that level in the blood will increase because the body knows something is wrong. We have an inflammatory problem, whether it's chronic infection, cancer, or something else going on. If we have an elevated ferritin, it can also indicate autoimmune disease. And so if we have inflammation there, we need to actually look for this as a possible cause instead of diagnosing it as a non-alcoholic fatty liver disease. So, and then of course, like we talked about, we can't have somebody drinking every day or binge drinking regularly on the weekends. We would push that liver issue more into the realm of alcoholic steatosis or fatty liver of the alcoholism. It is a non-NASH disease, so there is a form called non-alcoholic steatohepatitis, which is actually an inflammatory-driven disease. There will be inflammation in the body, like we talked about. We're trying to rule out inflammation, make sure that this is just typical insulin-resistant fatty liver, not driven by infection, inflammation, which is what non-alcoholic steatohepatitis is. That is an inflammatory-driven problem, not from alcohol, but also not from pure insulin resistant. There's something else driving this on top of that insulin resistance. What's interesting in the literature and in patients who've had their gallbladder removed have an increased risk of fatty liver disease. There's a relationship with that. And so is that the chicken or the egg problem? Because usually people that have gallbladders removed have insulin resistance. So is it the insulin resistance or is it gallbladder? Probably the insulin resistance resulting in the gallbladder removal, but they see higher rates after gallbladder removal of fatty liver disease. If you catch fatty liver early, we can reverse it. If it becomes moderate to severe, it can become fibrosis, also known as cirrhosis, which is scarring of the liver. And scarring of the liver in rare cases can become carcinoma, which is a word for cancer. So we have to be aware of that. We don't want this to progress. We don't want our liver choked. It stops detoxing properly. So let's move on here. So how do we stop it? It's actually fairly simple. If this is in fact caused from insulin resistance, we need to reverse insulin resistance. How do we do that? First step, weight loss, 10% of your body weight. We need to get this down. The studies show that people that lose as little as 5% show an improvement in the fat leaving the liver, but most of the studies show a substantial improvement at 10%. So how do we do this? Well, we got to diet. Unfortunately, if we have insulin resistance outside of an autoimmune condition, we are over consuming for our energy needs. We may be eating some bad foods in there that are known to increase insulin resistance, eating too much sugar and simple carbs, things like that. And of course, we want to exercise because we want to burn that free fatty acid that's circulating and cause the cells to be sensitive to the insulin, to get it back into the cells, out of the bloodstream, to keep it out of the liver. We know that metabolic syndrome, 80% have non-alcoholic fatty liver disease. So that's a huge, substantial portion. So how do we diagnose metabolic syndrome? Well, the first giveaway sign is if we have belly. We have a beer belly, that's a sign of metabolic syndrome. Our body is no longer metabolizing its energy properly. It's storing it on the central area of our body, also known as the belly. When this occurs, we tend to have higher rates of blood glucose because the cells are no longer insulin resistant to taking the blood sugar out of the blood. We start to become pre-diabetic and then eventually diabetic. Side effect of all this is we have high blood pressure, partially from the kidneys being injured from all that glucose circulating, but also because we have arterial injury and that inflammation from the high blood glucose drives that. The other thing that we start to see is because we have too much circulating fatty acids, we start to overproduce cholesterol and triglycerides. The liver has to deal with all that fat, starts to stress it out and starts to store that fat, and then it just becomes this never-ending cycle. So we also need to make sure we get our cholesterol under control. If we have fatty liver disease, we really got to be careful with alcohol because that is inflammation, can worsen that fatty liver disease and run to the cirrhosis, the fibrosis, the scarring. We may have to consider our meds. If we're on meds that are detoxed through the liver, we have to be more careful. You may want to discuss that with your provider. And the other thing found in the literature is there is a positive effect on reducing fatty acids with vitamin E at very mild doses. Vitamin E is fat soluble, so if you overdo it, you can overdose on a vitamin E fat soluble vitamin. And there is in the literature benefit to omega-3s. I know they've been in the news a lot. It's flip or flop. We're seeing good and bad advice. But in the literature, there is some benefit to the omega-3s as reducing inflammation. I put on here, this is from Up to Date. This is recommended vitamin E for your patients off-label with fatty liver, and which is the steatohepatitis. So I know they say 800 units, that's quite a bit, but notice the DL alpha tocopherol is 360 milligrams, and this is the synthetic form, versus 536 milligrams of the D alpha tocopherol. So there's just literally that L taken away makes it a natural form here for us to dose ourselves. If you have any questions, leave a comment. Thank you very much.